Protexa Endovascular has an opportunity to save limbs, lives, and quality of life years for millions who suffer from peripheral arterial disease in the US and the rest of the world. Procedures using balloons or atherectomy to open the artery and restore the blood flow will prevent amputation. However, these procedures liberate debris, which flows downstream and causes permanent damage to the microcirculation and the distal vulnerable tissues, even when the artery is opened. Frequently, the process of opening the artery causes the smaller vessels in the foot to be blocked and unable to deliver fresh oxygenated blood to the area of the wound. Occlusion of these smaller vessels may go undetected and may only present as delayed healing, worsening of ulcerations, needed reinterventions, amputations, and even death. This situation is common, is underreported, and a top reason why a patient could lose a limb even after a successful revascularization procedure. Personal experience by the physician founders of Protexa and an extensive literature review convincingly incriminates emboli as contributing to poor healing of distal tissues in many cases, even after successful revascularization. And BTK lesions are particularly susceptible to embolic injury as they are frequently small vessels, too small for practical use of distal embolic protective filters. Protexa's Guardian BTK catheter solves this vexing problem by providing proximal protective flow arrest during the intervention, along with aspiration of the liberated debris during and immediately after the intervention. This prevents the downstream embolization of the debris, obviates microcirculatory embolic injury, and gives the patient a better chance of healing the distal tissues. Simply put, successful treatment of the lesion plus protecting the microcirculation will provide excellent clinical outcomes and avoid the microcirculatory embolic injury that frequently occurs. Protexa Guardian BTK. Protecting the distal microcirculation from embolic injury ensures better healing and better outcomes through better technology. Hence, for the patient, a better opportunity for healing of tissues, overcoming the disability, and enjoying a better quality of life.